Thank you very much, Ibrahim, for those questions. And I know for sure that our guests are well catered for the response to some of those questions. Now, we have in our guests in our studio already seated for this program this morning some of our guests. Let me just start by introducing Dr. Isaac Akuma Eboja. He's the public health specialist. Dr. Eboja, you're welcome to Good Morning Nigeria.
Thank you very much. I'm glad to be here.
Also here is Dr. Kashmai Ifeanyi. Is the 15th National President, Association of Medical Laboratory Scientists of Nigeria. Is also a fellow West Africa Postgraduate College of Medical Laboratory Science and infectious disease expert. Dr. Ifeanyi, good morning to you.
Good morning. How are you? Good morning, yes.
All right.
All right, also joining us for the conversation via Zoom from Lagos is Dr. Ganiu Jamiu, the Chief Consultant Epidemiologist, Federal Ministry of Health and Social Welfare. Many thanks for joining us, Doctor.
Thank you very much for having me this morning.
All right, so let's just kickstart our conversation this morning with Dr. Eboja. You know, typhoid fever is something that is very, very common in this part of the world, especially in Nigeria. Everybody that has a little bit of symptoms, what do you have? I have typhoid. They have not even done any test or gone for any diagnostics, but they just assume that they are having fever or typhoid fever. So what are the common symptoms of this typhoid fever, and how do we distinguish, when you say this one has typhoid fever, this one doesn't have typhoid fever, what exactly is happening?
Okay, let me start by saying that typhoid fever is caused by a bacteria known as Salmonella, and a particular species of Salmonella known as Salmonella typhi. It is from that name that we have typhoid fever. It is an infection that leads to very high fever that could also lead to chills, muscle aches, nausea, vomiting, and in very extreme cases, it could lead to mental confusion, where a person becomes confused, delirious, and can even become psychotic. In other words, can be a little mad and uncontrolled.
Is that anything like little madness?
Yes. That's not very common, but it does happen. And coming to your question, yes, many of us are alarmed by the fact that everybody these days seems to have typhoid and malaria. As a matter of fact, when you send a patient to go and do a blood test for malaria, suspected case of malaria, when the result comes out, it is typhoid and malaria. I'm going to leave that aspect to Dr. Ifeanyi to explain. Let me handle the purely medical aspect. Normally, when it starts, the fever is low. The temperature is not very high. But the temperature will be increasing gradually. And it becomes very intense and very severe to a point where the body temperature could reach 40 degrees centigrade or 102, 103, 104 degrees Fahrenheit, which is very high. And one of the reasons why patients become little mad or psychotic or confused or delirious is because of that high temperature, which the brain cannot handle.
Okay.
That's an optimal temperature of the body generally. And the brain in particular is very sensitive, very, very. So when the temperature is higher than normal, the brain begins to respond. And when it becomes so high that the brain cannot function properly, the person loses control and becomes confused, delirious, and could be psychotic. Okay, let me come back again to the symptoms that we are talking about. During the first few days, like I said before, the patient may not have that high fever. The fever may be small, and it will be increasing. Now, the very important part of the question that you asked is the differentiation between the fevers of malaria and that of typhoid.
Yes.
I need to explain this. Okay. In the case of malaria, especially in our own environment here, the parasite that is common in our environment here is Plasmodium falciparum. How does it reproduce? How does it cause fever? Normally, every 24 hours, the eggs of this particular parasite are released into the bloodstream, and the person will now develop fever. Or the symptoms and signs of malaria will be increased at that time. Fever, sweating, malaise, weakness, and so on, headache, and so on. I forgot to mention headache for the typhoid too, but let me finish this. So if you typically here have malaria, you would observe that if it is mornings that your fever or headache comes, after about afternoon you feel well. Throughout the evening you feel well. But when the next morning comes, your fever comes back again. However, there are also some other people.
Why that?
I'm coming. That's what I just explained. That's the time when the parasite releases its eggs into the bloodstream. Okay. Now, there are other people, during the morning time, they are fine. As the afternoon comes, they become sick gradually. And then they start sweating, they have fever, they have headache. And after a while, they become a little well again until the next 24 hours. So there's a cycle of every 24 hours of this spiked fever and symptoms of malaria that is caused by Plasmodium falciparum. That is not the case of typhoid fever. Typhoid fever is relentless, it's continuous, it's consistent. That's the difference. But let me also come to explain something. Like I said before, I'm going to leave the test and the laboratory part for Dr. Ifeanyi. But the assumption or the perception that every fever is typhoid is wrong. Very wrong. It is not true. As a matter of fact, you would not know that it is typhoid until a test is done. It is only through laboratory tests that you can confirm. And when somebody goes to the lab, has a little prick of the blood, and then in a few minutes, they tell the person, you have typhoid and malaria. It's not possible. It is possible that it is malaria, but it is not confirmed test that it is typhoid at all. You have to do more tests, which I said I will leave to the doctor to explain, to confirm that it is typhoid. Okay. One. Two, for the treatment for malaria is totally different from the treatment for typhoid. And unfortunately, when somebody is suspected to have typhoid, many people start them with both malaria treatment and typhoid treatment, which shouldn't be. Treatment should be initiated for malaria, and there should be a delay, a wait, for the confirmation of typhoid before you institute treatment for typhoid. Because it is antibiotic that you are going to use, and somebody who uses antibiotic, if you continue to use antibiotic indiscriminately, you would cause resistance. So when you really need that antibiotic for the real typhoid or for something else, it will no more work.
All right. Many thanks, Dr. Abuja. You have so much to tell us, but of course, in the course of the program, we would get some more perspectives from you as regards typhoid fever. Now time to get to Dr. Ifeanyi. Accusing fingers has been pointed at the lab scientist as to why we have so many people who have typhoid fever. So maybe I should ask you, is it a wrong diagnosis that is making us feel that a lot of Nigerians come down with typhoid fever? Or is it that we have, we are involved in habits or our environment that is leading to the increase in the number of patients with typhoid fever?
All right, I would start with your intro. The visuals that we watched at the beginning, that was quite apt. And I want to say that going back to that visual, you had clearly that typhoid fever, of course, like Doctor said, caused by bacteria, Salmonella enteritica serovar typhi. It's a food and waterborne disease. Ingestion of contaminated food and water. And if there's anything commonplace in Nigeria, it is the consumption of contaminated water and food. Commonplace. And if you go further in the epidemiology of the disease in country, you will find out that typhoid fever is a lot more preponderant in major cities with slums like Lagos, Kano, Abuja, Port Harcourt. This is the rife place for ingestion of contaminated food. Of course, it happens in the hinterland and in the rural places where we have poor sanitation and hygiene. And so if we do not speak to these key factors, we will never get over with typhoid in Nigeria. Now, it's endemic in Nigeria, correct? But these are the factors that fuel the endemicity. What do we do? What is our food safety protocols? What are they? Now, in our food processing and production, do we bother about hazard analysis and critical point control? We do not. We eat anything we find. But I will speak to the issue of diagnosis, so I don't delay. Now, you used the right word, wrong diagnosis. Over-reporting of typhoid fever. Who is responsible? Who are the culprits? Today in Nigeria, as you walk the street, you see a pharmacy. You can walk in there, they tell you they do tests, and they will do typhoid for you. As you walk the lungu, permit my word, the lungu, you will see a patent medicine shop. A half-literate person would also take your samples that he is doing typhoid test for you. As you go further from the lungu into the crannies of the slum and other places, even on that tree, you can find somebody holding himself out to the public that he is able to perform testing, particularly for typhoid. And so we have to also speak to the issue of the meddlesomeness, the intrusion of quacks and charlatans. Today in Nigeria, the average graduate of a biological science course, microbiology, biochemistry, physiology, zoology, science laboratory technology, would want to and are attempting by all means to legitimize themselves as people who will provide healthcare services with respect to medical laboratory services. When you have all these factors come together, you will now see why for every test you have, they will tell you malaria, typhoid. Because tests done, not rightly done, not even the correct specimen were taken, not done by the right personnel. So the issue continues. If we even go further, the diagnosis of typhoid is very costly. Typhoid fever have 4 stages. Like he started, low-grade fever, not pronounced. That's the first stage. And that will happen from the 3 days of you becoming exposed to the bacteria to as much as 60 days. First phase, low grade. Second phase, the fever becomes very pronounced, like he said. And the fever becomes pronounced with gastrointestinal issues beginning to show up. So you could have cramp, you could have abdominal discomfort. For some people, you can have diarrhea. So that is second stage. Now, the third stage is very difficult. The third stage is an advanced form of the second stage, where you can have intestinal bleeding and ultimately intestinal perforations. The first stage is either a recovery phase or a complication phase that can lead to the delirium he talked about earlier on, or even ultimately death, if not treated and not properly treated. So for these 4 stages of typhoid, within the first 1 week of ingestion and exposure to the bacteria, if you want to test the gold standard for the diagnosis of typhoid within the first 7 days is blood culture. If you go to any hospital laboratory, what it sought, and you want to do a blood culture, you will not be parting today with less than 30,000 or 40,000 naira or more, depending on the hospital or laboratory. And so, after the first 1 week, when, of course, you now have the gastrointestinal involvement, for which reason it is also called gastroenteritis, all right, or enteric fever. And so at that point is when you may be able to recover the organism when they are becoming shedded in the patient's stool. And when you talk about stool, you will be talking about stool culture a lot more. Urine, the ability to recover salmonella from urine is far removed, very far removed. So recovering it from stool would mean that you must have a robust laboratory infrastructure, a well-resourced laboratory. So the diagnosis of typhoid...
So do we have well-resourced laboratory all over the country?
You can't have a well-resourced laboratory in a pharmacy in the boulevard. You can't have a well-resourced laboratory in the patent shop at the Lungu. You can't have under the tree. So the point is, do we have a well-resourced lab? So Nigeria comes under the category of countries that are called resource limited. Of course, we have resource limitation in country, but the point is not all made. So that is first week, second week. Now, you can go as far as even doing a bone marrow investigation, but that's when at the point of the complication, and must not be done by the roadside. Must be done in a full-fledged hospital with capacities for that. Capacities in terms of infrastructure, resources, which includes material and human resources. So the challenge we have with typhoid fever in Nigeria, and why it appears is the boss illness. Oh, every person has typhoid. That's not entirely correct, because we are not doing the right thing. And why are we not doing the right thing? I've mentioned charlatans, I've mentioned quacks. I want to speak to another challenge. We're talking about resources. Nigeria is apparently, I have said it here on this same seat, apparently the dumping ground for fake and substandard reagents, diagnostic kits, and testing material. Nigeria is second to Egypt and South Africa.
Who should regulate this?
I'm getting there. Nigeria is second to Egypt and South Africa in the importation of medical diagnostics in the African continent. Nigeria has a very robust law. Nigeria has in place a flagship agency of government, the Medical Laboratory Science Council of Nigeria, who is saddled with the regulation of both those who provide the testing and where they do the testing, no matter where it is, doctor's office, laboratories adjoining hospital, standalone laboratories, wheresoever it is. The Medical Laboratory Science Council of Nigeria is the flagship agency of government that regulates those who do this practice and the place of practice, and that regulate the processes that give you the certification and the accreditation to provide that kind of testing. It is also this same agency that is saddled with the responsibility of validating the materials we use for this test. Before I end, Doctor talked about you walk into a place, they do a venipuncture, and they just do stuff, and they say you have typhoid. Now, the common thing we do, 80 to 95% of the time, is what is known as wider test. Wider test is a serological testing. It's a non-specific screening testing. And the challenge we have in Nigeria is that if you go to the Idumota market, or you move around the streets of Abuja, or you go to Kano, you will find over 1,000 brands of the wider test kit. I'll give you an example. There is one that is sold for about 35,000, 40,000, and there is one that is sold for 4,000 naira. And so these things come into this country, they don't go through any form of validation. People break the law willfully. Because the Medical Laboratory Science Council of Nigeria is also saddled with responsibility of validating test kits, test device, reagents before you deploy them.
Why do you think, Dr. Ifeanyi, that people patronize all these quack laboratories? Is it because of the, because you said it's quite expensive and they are not, easily seen? I mean, the standardized laboratory, where do you find them? Only in government hospitals?
No.
Even in government hospitals, you hardly get...
Well, we have standard labs, standard, in quote, both in private and public, standard. Now, the point is this. I've mentioned charlatans. You won't find these charlatans in standard places, even though they're making efforts to find themselves there. I tell a story of a tertiary hospital in the FCT where my life was put at stake because I blew the lead when an industrial chemist, someone who has a degree in industrial chemistry, was employed and deployed to the lab. So what kind of typhoid testing will that individual provide? That is the challenge we have. If we must deal with the issue of typhoid, there are factors we need to do. It's not only in the health industry we need to deal with. Let me come here now. I don't know whether you're familiar with the story they call the Typhoid Mary. You may not have heard about the Typhoid Mary. The Typhoid Mary is a common story we were told as students that happened, real life story in England. Mary, a chef, had typhoid. And for all that ate her meals, they came down with typhoid. For as long as she was cooking the meal and serving them. Now that brings me to another aspect why I talked about hazard analysis and critical point control. All the people who serve the food you will leave here to go and eat in Mama Put, who does food handlers evaluation for them? Any form of food handlers test?
Before we get to food handlers, so the duty of the Medical Laboratory Science Council of Nigeria, which we have mentioned, why are they failing to, do their job? Whose fault is it? Is it the council, or is it those who bring in these reagents and all of that into the country? I mean, where's the gap?
Two things are at stake here. It takes two to tango. The council has got the law and the mandate. And the
so why are they not doing their jobs?
I'm coming. The council has gone a step further to prepare itself for this assignment. The council has an in vitro diagnostic laboratory where this validation is done in Yaba, Lagos, fully equipped to the teeth. During the COVID pandemic, most of the COVID kits that came into this country, the council put its foot on the ground and insisted that they were evaluated. What we're asking that should be done is that for every test kit, every test reagent, every test equipment, laboratory equipment that comes into this country should be subjected to validation as provided in the law. Now you have these merchants. Sometimes I prefer to call them merchants of death. You have these merchants who will bring these things here, and because they have the financial war chest, they resist the processes. They don't submit to the process. And you also have bureaucracies playing into it. I am a top government functionary who will approve the purchase of these things. And I bring my crony, my friend, whoever they are, who goes to China to bring this substandard thing, and it is dumped in the warehouse, circumventing the validation. So we must speak to these issues. The Nigerian health sector requires a reform, and that reform must conform to global standards.
We must conform to global standards. Oh, Dr. Ifeanyi, okay, we'll pause you there. Let's bring in our Zoom guest as well, Dr. Ganiyu Jamiu, to also, let's have your perspective on this prevalence of typhoid fever. Tell us what your experience is like.
Well, based on literature, there have not been a national prevalence, a survey to actually estimate the prevalence of typhoid fever in Nigeria. However, there have been a couple of studies, like the one in Abuja recently, 2023, fairly sector, which reported that an incidence of 100 in 100,000, with a prevalence of about 20 after a kind of following can you hear me? Finding from a systematic review also revealed that the prevalence of typhoid fever from a study is around 20.9%. And I want to clear it to us that the environment, our personal hygiene, will enable us to continue to be exposed to typhoid fever. I want to also clear that it's not only Salmonella typhi, we also have other strains that we call them paratyphi, ABC. It's not only we have Salmonella typhi and we have Salmonella paratyphi, ABC. The only issue is that the paratyphi ABC present with milder form of the disease. But the one we are a bit worried about is the typhi. And as I've said, apart from personal hygiene, the sanitary condition of the environment, just like cholera, is an enabler for individuals to continue to be exposed to typhoid in Nigeria. For instance, other speakers have mentioned the issue of contaminated food and drinks. Those are another way. And also, we can also have it through, can you hear me, from hand to mouth. Some people will go to the toilet, they will not wash their hands, they will not use the same contaminated hand to eat and so on. So these are some of the other ways. And also, there are a lot of contamination of underground water through a kind of poor construction of septic tanks. So in most homes, especially in the urban areas, you find that some of the underground water sources have been contaminated. And that is why you see, apart from having typhoid, high prevalence of typhoid, we also have the same thing as cholera. So those are, can you hear me?
Yes, we can. Please go ahead.
Okay, so that is why we continue to have this issue of Salmonella typhi, that's typhoid, has to do with both personal and environmental hygiene. Then another thing I want to clear is that the pathophysiology of typhoid actually starts from the gastrointestinal tract. The organism actually infects the distal part of the small intestine, that is the ileum. That is when the whole inflammation, everything starts. From there on, it will move to the Peyer's patches. That is a towel that covers the small intestine. And from there onward, it will move to the other system through the thoracic duct, you may not understand that, and that may get to the liver, get to the spleen. That's why you see many of them complaining of abdominal discomfort, abdominal distension. So these are some of the ways. One thing, again, we need to understand about typhoid is the fact that studying the incubation period of 1 to 3 weeks is very critical. During the first week, what we have are just the normal flu-like symptom of fever, and the fever is usually step ladder. What do I mean by step ladder? It starts gradually, then gradually the temperature increases toward the day to about 39 to 40 degrees, which is associated with chills. Then we're having a frontal headache, having malaise, and so on. So those are the symptoms during the first week. Then from the second week, that is when individual will start showing signs of diffuse abdominal discomfort, abdominal swelling, delirium, confusions, and so on. Then from third week, if it's an untreated patient, third week, fourth week, that's where they can present with complications. Apart from the intestinal perforation, which can lead to emergency, we can also have internal bleeding from that. And also, it can also result to sepsis, that is septicemia. That is the whole, the bacterial-related toxins that will affect every organ in the system. And that is, it can affect any system, and that is why, starting from the brain, it can lead to meningitis. In the heart, it can lead to myocarditis, pericarditis. It can affect the lungs. It can affect the muscles. That's why, and bones. That's why we have osteomyelitis. It can affect even in men, orchitis. So there's not any part, especially in the advanced stage. It can lead to it can even, apart from the heart and whatever, the liver. That's why many of them we have what's called hepatosplenomegaly. The liver will be swollen, the spleen will be swollen, and that is one of the common presentations of typhoid fever. Thank you.
Dr. Jamiu, from all that you have said and what the doctors have said right here in the studio, it is clear that typhoid should not be joked with. And of course, what already comes to mind is why, individuals who want to play with the health of, of Nigerians and, bring in all kinds of materials that are fake. And then we have people who are quacks carrying out testing for typhoid. We'll get back to you, Dr. Jamil, but let's return to the studio. And I'd like to ask Dr. Ibuja. Well, just before we get to Dr. Ibuja, you can send in your comments, your questions or suggestions to the number displayed on the screen. Send SMS or you can send a WhatsApp message. Please do not call. Thank you very much. All right, so let's get to Dr. Ibuja. I'm a bit worried about all of this. I mean, hearing all the big names Dr. Jamil was calling and then listening to you earlier, and then he's talking about affecting every part of the body. And I listened to Dr. Ifeanyi, say that it's caused by bacteria and that if someone cooks who has typhoid, I mean, you could transfer it. So, I mean, it can easily spread. A lot of issues, and you already talked about antibiotics being overused when you do not have it, and then eventually when you come down with it, it is untreatable. What really is the problem with our health system as regards this particular disease, in your own view? Because I tried to ask Dr. Ifeanyi about the medical council, which he said, about regulating the scientists who do the test in the first place, and then those who import the materials for the testing that are fake. So how do we get it right, really, in dealing with typhoid? Because, I mean, a lot of people's health may just be going down the drain.
Okay, I think the problem is not that much of the health system. I think it's more of our behavior. I think the public should take responsibility for this. I will explain. If you have fever and you go, like he said, to a quack, instead of going to the hospital for a test, you cannot blame the health.
But how do you ascertain a quack, for example? Because from what he has said, even in established health facilities, you still have quacks. He talked about an industrial chemist who got signed up for a medical lab scientist job.
Yeah. Well, those kinds of cases can occur, but they are not the norm. They are not common. Let's put it this way. But let me explain why I said the public should take responsibility, and why I said also that the high incidence of typhoid that we have is because of our behavior. First, let's start with ourselves. Our hygiene practices are very poor. Most people don't wash their hands. Most people don't wash their hands. If you go outside and you shake hands with Mr. A, Mr. B, and you touch this and you touch that, you don't know who touched that plate before you. And then you go home. Maybe you have a small baby, you carry the baby without washing your hands, transferring whatever is in your hands to the baby, whose immunity is very low. That's point number one. Point number two, we eat things anyhow. Even in the cities, like he mentioned, if you take fruits, which we advertise that people should eat fruits, should eat vegetables, and so on. Fruits are very good. But if you don't eat it the right way, you can get yourself into trouble. If you go to the market and you pick a mango or you pick an apple and you don't wash it and you eat, some people say, I'm an African. This is not a kill African. Who told you? You should wash whatever you are going to eat. Even vegetables that you buy from the market. Some people just rinse them a little bit and they start cooking. Why don't you wash it properly? Put water in the salt in the water that you are going to use to wash your vegetables. Soak it for a few minutes. Make sure you transfer it to a cleaner water, and make sure that the vegetable is clean before you cook. But if you are going to use it for salad, you could wash it 2 more times to be sure that whatever is there is washed out. Then, the mode of cooking. Many of the foods that we eat are supposed to be well cooked. And many times they are not well cooked. And let me come back again to this issue of personal hygiene. You see a lot of people with nails. A cook, a chef, is supposed to have fingernails that are like my own. Well manicured. Not with fingers where bacteria and viruses could hide. He gave example of a cook who would spread typhoid to everybody, and it happens
Mary
very
typhoid.
frequently. Very frequently. Even in restaurants. It happens very frequently. You may not know. But the reason why I emphasize on our behavior and on hygiene is because if you look after yourself very well, you wash your clothes. You wash your clothes, your food. You make sure that your water is safe by either boiling or it is treated. And you make sure that you don't take contaminated things to your house. Let me give a very ignored
When you say
example.
contaminated things.
Yes, I will give a very ignored example. You see sewage water flowing on the street, which you see sometimes even in Abuja. A car drives through it. All the tires rub on that contaminated water, which could have Salmonella typhi in it. The owner goes and parks the car, tells the houseboy to go and wash the car for him. You know what he does? In Nigeria, unfortunately, the first part of the car they wash is the tire. Have you ever noticed that? Who cares about the tire? No, they don't worry about that. It is not the car, not the windscreen. It is the tire that they wash. And he spends time, he enjoys himself, rubbing his hands on the tire very well, which has already carried bacteria or virus. He comes and then handles food, and then he eats. He gets typhoid. By the way, do you know that if I have typhoid, I can also transmit it to you by close contact? If I soil my clothes, for example, I have typhoid, and you and I are playing, and I have soiled clothes. What do I mean by soiled clothes? I went to the toilet. I didn't wash my hands, and you are also touching me
Or hug you.
and hugging me, and you carry them in your hands, and you eat. You ingest the bacteria. Let's understand the fact that if we keep ourselves clean, keep our environments clean, drink clean water, eat clean food, well-cooked food, well-processed food.
You just talked about clean
We will
water now.
eliminate.
You know, talking about clean water, I'm asking how many communities have clean water in Nigeria?
That's a problem. That one is a really big problem. Even here in Abuja, there are many parts of Abuja that don't have potable water. People are fetching water from the well. People are using boreholes. Boreholes are even safe or safer than open wells. And in the village, for example, if a particular well is contaminated with any bacteria at all, but since we are talking about Salmonella typhi, the cause of typhoid fever, everybody is fetching water from that well, taking it home and drink. They are exposed to the same problem.
Okay, doctor, let's look at the treatment now. Let's look at the treatment because there are a lot of complications, when it comes to treating typhoid fever. So how would you advise, health providers to manage complications and also reduce mortality rate as a result of associated with typhoid fever?
Okay, let's start with the patient first. I would advise that instead of you going to a patent medicine store for your treatment of fever, any form of fever, please go to the hospital. Instead of going to the pharmacy for a blood test, please go to the hospital.
What about primary healthcare centers? Because some people don't have hospitals.
Yes, primary healthcare centers are supposed to be well equipped and are supposed to be able to handle this type of tests. They're not that complicated. Unfortunately, some of them do not have either the correct reagent or they don't have the knowledgeable staff to do the test. And since he is talking about treatment, the person who is treating should be sure of what he is treating before he prescribes or gives drug to anybody. A suspicion is not enough as a reason why you should throw antibiotics at somebody. If somebody has fever and he goes and does this quick test and they say he has typhoid and malaria, which I already said is not true, as a health practitioner, take the one that you know is a confirmed test, which is, in this case, will be malaria. Treat it. If it is typhoid, the first few days of typhoid will not kill you. It will not. But the first few days of malaria will kill you. And in medical practice, if you have a patient that has multiple problems, we look for the one that will kill the patient first. That's our priority. That doesn't mean that the others are not important, but you have a priority here. If you don't do this first, the patient is going to die. So handle that first.
Okay.
If we have that kind of attitude, we will eliminate this indiscriminate use of antibiotics and the overprescription of drugs for typhoid when there is no typhoid.
Typhoid. Many thanks. Because of time, I'd like to get to Dr. Ifeanyi now. I'm asking, how can we strengthen the Medical Lab Science Council of Nigeria that you mentioned, just so that they can do their jobs effectively? Because first and foremost, if we can check the fake reagents and test kits coming into the country, we've dealt with the problem somehow. And if we can also check the quacks, get them out of business, isn't that a way forward?
Political will. Political will. The council has a superintending ministry. I'm particularly happy that the set of ministers we have now, the Honorable Coordinating Minister of Health and Social Welfare, Professor Alipate, and the Honorable Minister of State, Dr. Ishak Lakunle Salako, are square peg in square holes. It hasn't always been that way. So they are doing a lot. If you have a situation where they do not receive the support that they require, that's why people can beat the system and walk away with it. As for capacity and systems and infrastructure for validation, I can beat my chest to say that today in country, the Medical Lab Science Council of Nigeria has got that. It is the envy within the sub-region. There is no other country within the sub-region that has such capacity. So I do not see why we would have all that and yet be the lead country in the dumping of substandard equipment. Again, is that we have people who know that by training, by legislation, by mandate for the training they have, they are not supposed to have anything to do with testing of human specimen, including animal specimen, yet they want to hijack that processes. It's another problem. That is quackery. Now, but having said that, you see, the challenge about typhoid fever, it's worrisome. We're just talking about typhoid fever. There's salmonellosis, which is a different kettle. They are related. Typhoid fever is integral to salmonellosis. Now, if we want to deal with the issue of typhoid fever, we have to strengthen our laboratories, make them properly resourced, retrain our medical laboratory workers, particularly medical laboratory scientists, and see how government can reduce the cost for some of these test kits. The current government had done a lot. They gave a waiver for import for medical devices and all that. The government also provided funding to promote local production. That's quite commendable, and it is helping in some way. But the point need to be made clearly. If you are sick and you need to do a test, it must be done by a medical laboratory scientist. No matter where private or public, you have to ensure.
Dr. Ifeanyi, we have some responses from our viewers which would like you to respond to. Some of our viewers have sent comments and questions. Let's just quickly read them out so that you can respond to some of them, and also the doctors as well. It said, "Good morning, Nigeria crew and analyst in the studio. Thank you. What does FMH and SMH do about food vendors, hygienic and water situations in Nigeria?" That one is from ATS from Uyo. Then this one says, "Good morning, sir. Please, can malaria cause stomach pain when you have malaria? That is, when you have malaria, can you have pain?" Then this one says, "Good morning. Good talk on typhoid fever. My question is, in rural area, no help for them as regards testing them for typhoid." Why don't you deploy personnel that can carry out test routine in rural areas and not urban only? The one says, good morning, sir. My diagnosis is too costly to assess in the government hospitals, not to talk of treatment in government. Why? Is it because of the high cost of treatments in the hospitals that promote the roadside physicians? And this one says, update on the ongoing... Oh, okay. All right. I think
All
she
right.
has some.
Yeah, there are more messages here. This one says, good morning, sir. I have treated malaria and typhoid through injection, but I'm still having constant headache and fever. All right, I think you need to go to the hospital. Doctors cannot diagnose over the TV. But this one says, good morning, uncles. I'm Aisha from Kaduna. Mine is a question, not on typhoid. Okay, well, you need to see a doctor. She says she's having difficulty raising her left arm. Maybe she needs to consult Dr. Abuja. Well, good morning. This is an interesting topic. Please, how long should the proper typhoid fever test take? And what is the process of the test? That's coming from Mr. Lloyd from Lagos State. And one last one says, tackling the menace of typhoid requires adequate hygiene in every part of our environs. That's coming from Ben. Also, you would respond quickly to some of those messages, but we quickly need to join our correspondent who is at the court at the moment, and that's he's there to give us an update on the High Court sitting, which will take place today. It's meant to deliver verdict on the civil suit initiated by the senator representing Kogi Central Senatorial District, Senator Natasha Akpoti-Uduaghan, against the Senate President. Dele Atumbi, if you can hear me, good morning to you. You're looking really good. So what do you think the verdict will be today? Good or bad? About this again, because looking at all the issues that has been raised and the fact that, I mean, every part of the body can be affected if you have typhoid.
So maybe we'll just have your parting
final
shots.
Yeah, in 30 seconds.
One, typhoid is preventable and typhoid is treatable.
Typhoid is preventable and typhoid is
so once you
treatable.
establish that it is typhoid, the next is diagnosis. Okay. Is it really typhoid fever you have?
Okay.
Or you have another thing. So
all
it's
right.
treatable, it's preventable.
It's preventable and treatable. Thank you, Dr. Ifeanyi. Let's get to Dr. Ganiyu Jamiu. Let's get your parting shots on these discussion this morning.
Okay, thank you very much. I just want to say malaria can also mimic typhoid. So the only way we can do is to carry out appropriate diagnosis. Then secondly, the way we interpret weather tests in this country, I think the medical personnel, they need to look into it. There are systematic approach. Not one-off weather test is a confirmation that an individual has typhoid. Then lastly, we need to start looking at the possibility of introducing typhoid vaccine into our routine immunization, has been done in Liberia, Malawi, to save the children. And let's even start taking care of our children who are more at risk of typhoid.
Okay. All right. Thank you so much, Dr. Ganiyu Jamiu, for that. We should try to introduce typhoid vaccines. Oh, Dr. Abuja.
Okay. If we practice personal hygiene, environmental hygiene, safe water and food, we will eliminate most of the cases of typhoid and other diseases that we have that are waterborne or foodborne or are caused by contamination of the food or water that we drink.
Thank you very much, Dr. Abuja. Wish you improve our personal hygiene.
All right, many thanks to Dr. Isaac Akuma Abuja, Public Health Specialist. Thank you for being our guest. We appreciate you. Dr. Kashmir Ifeanyi, 15th National President, Association of Medical Laboratory Scientists, Fellow, West Africa Postgraduate College of Medical Laboratory Science, and a Public Health Advocate. It was a pleasure to have you again.
Thank you.
Thank you. And also would like to appreciate Dr. Ganiyu Jamiu, who joined us from Lagos via Zoom, Chief Consultant Epidemiologist, Federal Ministry of Health. It was a delight to have you. Looking forward to another conversation, of course. All right, so we take a break. When we come back, we get into the second conversation. Stay with us.